Okay, in this video, which will be relatively short, we're going to talk about some common drugs and their mechanisms. We're going to focus here on drugs that tend to be abused and drugs that tend to show up in substance use disorders when we talk about clinical diagnosis. The first drug to talk about is nicotine, and we talk about it first because it's very common in terms of substance use disorders. Nicotine, of course, is found in cigarettes and other things like vapes and gums and that sort of thing. Nicotine is psychoactive in that it has a psychological effect on our nervous system, particularly it leads to stimulant effects by acting on nicotinic acetylcholine receptors. It's actually the name nicotine refers to its effect on those types of receptors for acetylcholine. Now we talk about nicotine first because it is very commonly used. It's very commonly diagnosed as a substance use disorder because nicotine is highly addictive. Some studies show that about 68% of people who try nicotine become addicted to it versus 23% for alcohol and 9% for marijuana. And then it's quite difficult to stop taking nicotine. About 20% of attempts to stop are successful for 2 years or more. So 80% of the time people attempt to stop and don't. Nicotine is also something to focus on because it's the leading cause, at least currently, of preventable death in developed nations. So it's not a higher death rate than cancer more generally, right? But cancers aren't all preventable, right? So in terms of preventable death by simply not smoking, that's the leading cause. Now, why do people keep using nicotine? Well, there's a lot of drug craving. There's tolerance. There's also contextual conditioning. And when we talked about conditional tolerance, right? There's contextual effects where people will smoke cigarettes at certain times of the day or in certain contexts while on a break at work or after a meal. And that conditioning and learning can lead to habitual use. Now, why does nicotine lead to preventable death? Well, it's the delivery mechanisms, right? By smoking cigarettes, we get all of the extra substances that come along with the cigarettes that aren't just nicotine. There's some research that vaping may be safer than cigarettes, but there are some risks, and that research continues. Next up is alcohol in terms of amount of use and substance use disorders. Very common, of course. Alcohol has depressant effects, right? And it has those depressant effects in pretty general ways. It agonizes GABA, which is an inhibitory neurotransmitter, and it antagonizes glutamate, which is an excitatory neurotransmitter. So you can see that overall, alcohol is going to reduce brain activity. In terms of psychology, though, the effects are kind of dose dependent. So at a low dose, the neurons actually kind of stimulate in response to a low dose of this depressant, kind of in reaction. And social interaction is actually facilitated with low doses. And then you get the depressant effects with moderate doses, including cognitive, reductions of cognitive abilities, perceptual abilities, verbal, motor, and emotional processing. You also get hypothermia and red flush. At high doses, of course, people lose consciousness completely and you can die. There's tolerance and physical dependence that comes along with habitual use of alcohol. Whether somebody habitually uses alcohol and develops a substance use disorder has a major genetic component. Okay, in terms of the levels of physical withdrawal, the levels of tolerance, right? So that physical dependency has a genetic basis to it for alcohol, which can lead some people to be more likely to develop physical dependence. And while withdrawal, of course, includes hangover symptoms and tremors. Alcohol is socially accepted, but it is quite dangerous in certain, depending on use and context. About 3 million deaths due to accidents, health issues, and violence, interpersonal violence, can be attributed at least in part to alcohol. And then there's a number of biological effects, cirrhosis of the liver, as the liver has to break down the alcohol, and that puts a strain on the liver. Korsakoff syndrome, which we talked about in the memory chapter, can be caused by long-term alcoholism. Fetal alcohol syndrome, if you consume alcohol during pregnancy. Insomnia, alcohol affects sleep patterns. And then there can be transgenerational effects where alcohol use can change epigenetic factors, and those epigenetic factors can be passed on. So a number of psychological and biological things going on with alcohol. Next up is marijuana, which is like cigarettes and alcohol becoming more socially acceptable. Marijuana, of course, is the dried flower buds of the cannabis plant. There's a number of ingredients in the plant, but the primary psychoactive ingredient is THC, tetrahydrocannabinol. In things like CBD oil, the idea is that you remove the psychoactive, you remove THC specifically, and then you leave some other compounds in there that might have some psychological effects or might not, and you get a placebo, that kind of thing. Psychological effects of marijuana include positive effects like well-being and enhanced sensation, but also some negative effects including judgment, memory issues, short-term memory issues, paranoia, speech slurring, and motor impairment. So you definitely shouldn't drive if you're on THC of any kind. A lot of people say that you can't become addicted to marijuana. Typically what they're saying is that physical dependence and withdrawal symptoms are not necessarily common with marijuana use. But the DSM-5 does have a category of substance use disorder for marijuana. Keep in mind that a substance use disorder is not just a physical dependency, and so if there's continued use of marijuana, if the use of marijuana is causing issues in somebody's life, and they're trying to stop but not being able to, then certainly you could be diagnosed with a use disorder. You may be aware that marijuana is now being prescribed for medical use. Of course, some of the medical effects are negative. If you're smoking marijuana, there are respiratory symptoms just like there are with smoking cigarettes. But then there are some noted benefits. Research shows that there's some anti-inflammatory benefits generally. So the cannabis seems to reduce inflammation. So that can reduce nausea effects in people who are undergoing cancer treatments. It can reduce glaucoma. It can reduce some pain, and can actually be helpful for MS, multiple sclerosis. So the degradation of the myelin in multiple sclerosis may be due to inflammatory effects of the immune system, and marijuana may calm that down and reduce some of those issues. There are also some benefits for anxiety. That research continues in terms of medical benefits of marijuana use. There are, however, some long-term changes in developing brains in particular. There's research on this as well, and if you're in my class, there's supplemental materials with a review of this research. So while there may be some benefits of marijuana use in developing brains, there do seem to be some changes that tend to be negative. High use of marijuana during development may not be advised. Talk to your doctor. Next up are cocaine and other stimulants. And I've got a picture from Breaking Bad there. Some of the other stimulants that your book talks about in this category are methamphetamines, and they're making methamphetamines there. There's lots of stimulants. Caffeine is a stimulant, right? But cocaine and methamphetamines are the most dangerous and the most misused and most likely to diagnosed as substance use disorders. Most stimulants are going to have the mechanism of either releasing or preventing uptake of monoamines, particularly dopamine. Right? So you get more dopamine, which produces euphoria, and can also contribute to addiction, which we'll talk about in the next video. The immediate effects of this stimulation, this dopamine release of certain kinds, is energy, feelings of well-being, euphoria, feelings of self-confidence. People go on sprees of use and binges of use as people seek more of this stimulant, energy, and well-being. So this is why people do these drugs. There are a number of downsides, though, right? So besides the addiction that comes from use, there's a number of medical effects that are negative. Overdose, leading to potential death, sleep issues, tremors, psychosis. So cocaine-induced psychosis is possible, where you lose track of reality. You can have medical issues like strokes and heart attacks. And then long-term use can lead to cognitive impairment, Parkinson's disease, heart pathology, and can be passed down epigenetically as well. So a number of negatives. And so you can think whether an immediate burst of energy and well-being might be worth these possible consequences that you may not necessarily have control over. Next up, and finally, we have the opioids. This is a class of drugs that includes opium, which is where the name comes from, derived from poppy plants, so it's natural. And all natural things are good, right? Morphine, heroin, OxyContin, Vicodin, fentanyl. You've heard of lots of these. They're all very similar substances. Most use of opioids is legal prescription drugs, and they are prescribed medically because they're pain relievers. Opioids bind to opioid receptors in the periaqueductal gray of our midbrains, and they're going to agonize the effects there, so that that pain-reducing mechanism is enhanced. So we have sort of a natural mechanism for reducing pain, starting in the midbrain there. It's kind of a complex process, but that exists naturally, and then the opioids that we take bind to those receptors and have the same effects. Beyond pain relief, of course, there's other psychological effects that come along with these opioids. You get a feeling of euphoria, but kind of a drowsy euphoria, which is different from cocaine, which is a very high energy euphoria, and just general feelings of pleasure. Opioids have high levels of physical dependence, high levels of tolerance and withdrawal going on with opioid use, and are highly addictive, highly likely to lead to substance use disorders. Less likely than nicotine, but maybe higher certainly than marijuana. There's a number of side effects to opiate use that oftentimes lead people to seek treatment, including, of course, withdrawal as a result of the physical dependency, constipation, pupil constriction, reduced sex drive, overdose, which can lead to death, and then some effects that can be passed on epigenetically. What you'll notice is that a lot of these are, so constipation, for example, right, as a result of opiate use. If you're reducing pain quite a bit, oftentimes people experience constipation. What you're doing is kind of slowing down your body, right, and reducing your body's activity. And so you're preventing your body from expelling what's in there. We're weakening the muscles as an effect. Initial treatments for opioids typically try to replace the opiate with less pleasurable and less physically addictive opiates. So that's where methadone clinics come in. Buprenorphine is a newer version of that. So if you've heard of methadone clinics or buprenorphine, what those are opiates that have less pleasurable reactions and less dependency associated with them, and you kind of wean off of opiate use. U-Book has a graph. When we're talking about these, the reason we kind of went in the order we did, or at least the reason we started with nicotine and alcohol, is because the number of people who are dependent on these drugs varies quite a bit, right? So tobacco and alcohol involve hundreds and hundreds of millions of people. Opiates, then marijuana, then cocaine and amphetamine. So things like cocaine may get a lot of media attention because of the level of psychological effect that goes along with it and the danger associated with intense use in binges. But the number of people dependent on alcohol is much higher. Okay, next time we'll talk about addiction and how that works. If you're interested, there's a link here, and it'll be in the supplemental materials for students in my class. Check out this page, which has a lot more than just the one graph on drug use and drug use data, across states or across countries, and drugs of different kinds. Okay? So check that out if you're interested in more data.